Hello everyone, Melissa Timmons back. Wanted to talk to you a little bit now about the Preceptor case studies that you've completed. So we'll start with this first one. During your shift, you notice that your orientee Marge is not using the lift properly. That could put then the patient at risk to injury. You step in between, intervening appropriately, which is a really good approach to patient safety. But then your orientee Marge says, "But that's how you showed me the last time, and you keep changing things." And the patient is hearing all of this all along. So just thinking about some of the responses that you have included, what type of conflict did you think was happening? Think about the three different types: intrapersonal, interpersonal, and intergroup. So interpersonal conflict is most likely what's happening here. It's the conflict that's happening between two or more individuals. Marge and you, the preceptor. So with that in mind, what might be some conflict resolution strategies that could be tried with this situation? So thinking about that, what might be some things right here in the moment that you could do? And just in that scenario, and I'm sure you guys have experienced some similar situations as you're trying to go through providing some orientation, you've got some skills that you want return demonstration on from your orientee, your preceptee, and these are things that are expected based off of your competencies. And here's one that we've encountered that the orientee is either having some challenges with or not understanding what those challenges are. So looking at some strategies, could this be an opportunity where you might respond, affirming that does seem like things might be changing quite a bit. Let's continue this process with supporting or assisting the patient at this time, and then we could talk more about it here as soon as we're finished. Some way to really acknowledge their response, but yet provide some direction on how we're focused on the patient's needs, and then we can kind of follow up. And maybe it's right after, or maybe there's other things that pull you from being able to have that conversation right away. But letting that orientee, letting Marge know, we'll talk about this so we can clarify what expectations are, is maybe they heard one thing when you went over the lift before, but you had said something different. A lot of times that communication and coming across with effective communication can be difficult when there might be other things that had interfered or created challenges or barriers in that interaction. So yes, I'm sure you guys each identified patient comes first. All right, let's figure this out. What are we going to do for this patient? And then identifying how to reassure and affirm feelings, and that's important. And then identifying kind of how we are going to circle back to this situation. What are some things that we need to address with this orientee? So some of those things as you kind of identified, and before we move on to what could we do differently, but even before that, so thinking about other strategies, maybe it would include pulling up some resources, some references, things that we can provide them some clear expectations on. As you guys can think of, with all of the skills, all of the expectations that we have, some things are going to be nice and written in a policy or a procedure, or there'll be some type of reference form or document that we could use to help support why we do what we do. But there are going to be some things that'll just be, this is our practice, this is our process in this area in this unit. And what might be some things then that you could do in order to help remember these things? And maybe in future state, this could be a project that somebody might take on. Is this the best way to do that? And how do we know that it's the best way to do that? So those are just some other things to consider. I'm sure you guys had some other really great strategies. And then what could have been done differently? So if we're reflecting back on the situation, you as the preceptor are stating, don't do it like that, you'll hurt the patient. Of course, if somebody comes at me pretty strong like that, I might get defensive. Or might I be more receptive and say, oh gosh, yeah, please intervene and help me. That might be the harder process, the harder step with that. At the same time, would there have been a different way that as the preceptor, you could have stopped what that individual was doing, what March was doing, and then finding a way to try to redirect and have the conversation on, let's take a pause for a moment and let me just make a few adjustments. So maybe it was the way that lift connection was, or maybe it was something with the controls or the base of the lift. So, let me make a few adjustments. We're getting ready to, put this in place, and I want to be sure that the patient is safe as possible. So might you still intervene, but doing so in a way that what you say and how you say it could be received in a way that the orientee would be more willing to understand and comply. So oftentimes when we come across in different ways that an individual perceives us as attacking them or as putting them down or not being as constructive as we think we are, it'll put that other individual on the defensive, and they may not really receive well and let that constructive feedback sink in how we intend to. Our approach will make the difference in that situation. And sometimes, I'll tell you guys this, some preceptors I know have developed code words in how to communicate, especially in front of a patient, how to communicate, hey, I think there's a concern, timeout or pineapple or whatever the phrase or word is, to help provide that pause and to help kind of stop that momentum from happening in a way that does not put you also in front of the patient where it doesn't look like people know what they're doing. So that can just be another way to have done that differently. After shift report, approximately your first week with orienting this individual, you as the preceptor say, hi, how you doing? So you're welcoming, you're pleasant, you've got good eye contact, and your orientee looking at their phone, hey, all right, so looks like we have a busy day. Let's get started. And then you start walking away. Orientee is like, I don't care, and just kind of slowly follows. Well, let's keep up. We got to go, start walking faster. So thinking about what are your main concerns with this interaction? What did you have for that one? Absolutely. So you might be thinking, okay, first off, the preceptor started off really well, right? That's positive, that's upbeat, it's, interactive, giving some eye contact and pleasant. But then, with that reception by the orientees, sometimes that can rub us a little wrong. Sometimes we feel, offended by that, or it might change our approach to how we're interacting with them moving forward. So I think that was the challenge with the preceptor situation, that, when you're not feeling that same energy, when you're not feeling that same kind of passion or drive in what you do, or, you're just even starting your day, that can feel really deflating. It could feel, challenging to try to overcome that. And then the orientee certainly does not feel like things are going well. So, there's a concern there. So concern on behalf of how the preceptor's approach changed, how their manner changed, as well as from the start, the orientee is not really receptive by your perception, right? It seems like they don't care. Seems like, do they want to work there? Are they even interested in being oriented? So when you're thinking about the barriers then to successful orientation experience, you might be wondering about what is their interest. You might be curious about, are there things that are barriers for them? If they're looking at their phone, maybe they're looking at their phone because there's a concern at home or a personal issue, or maybe there's some type of response or a phone call that they're waiting on, and they're like, oh, glancing at my phone, and that kind of distracts us a little bit, right? That pulls our attention. We may not be fully engaged in what's going on at that moment, right after shift report. So that I think can really make a difference then in how we're being perceived by others. Other barriers might also include maybe there's some differences or diversity either in personalities or in work practices or in experiences. So this doesn't have to necessarily be a new grad or a new nurse, but this could be maybe an individual who's had previous experience, and maybe they are concerned about the pace of their orientation, or maybe there's concern about the workload. I think we can do a lot of what ifs to help understand there has to be more to this story than what we know to be true. And on that same token, we have to really be careful about telling ourselves a story, right? So, we can look at this interaction and say, oh my gosh, this orientee does not care. They don't want to be there. They hate me as the preceptor. Or, we start creating these scenarios and these what ifs, what's going on. So until we can explore that more fully with our orientee, we have to be careful about that. So we can ask those questions. Hey, I noticed that you were looking at your phone right after a report. We do have a particularly busy day. Is there something else going on? And that might have been a better approach. And just kind of thinking about some other strategies that you identified that might have been a better response, especially with the orientees kind of very limited response to our initial kind of, hey, how are you? And we're excited and we're not feeling that same excitement. And what do we do about that? So it's like, so I think having a game plan, and I've heard really great strategies from preceptors, and you guys probably already have this in mind anyway, is some really great strategies to help at the start of a shift, especially early on in this orientation process. As you can see, this is our first week. It really may be using those goal sheets to help drive productivity throughout the shift that can help give us some plan and some sense of accomplishment at the end of the shift. So having that process and having that short discussion, we've got to huddle really quick. Okay, let's come up with a game plan. What do we want to accomplish? What are our priorities with our patients? And just really identifying what's that plan for the day and what does that look like? Okay, and I know you saw this one. So thinking about approximately first week in orientation, you're the preceptor. Hey, we've got this competency. They make us do it. The orientee is like, ugh, I already know how to do all of this. Just sign me off, right? And so you could see how that dialogue goes through. I don't have time. Yeah, I have to go check on patients. I'm sure each of you guys have felt the struggle of balancing orienting an individual and patient care. And if something's going to give, it's going to be that orientation process, because our patients come first, and we all know that, and we understand that. So our concerns is that the approach to the preceptor already kind of starts that thought and that mode that, maybe these aren't as important as I thought they were, or as that they should be, and we're just checking some boxes. Right? And so that can definitely make a difference on how serious that orientee then will take those competencies, as well as maybe that whole orientation process. So thinking about those barriers, just the frame of mind, and maybe, and we could think about some what ifs, you guys, right? What if, as the preceptor, I'm feeling just a little bit overwhelmed. I'm feeling that, I might be seen as a really good preceptor, so I'm precepting back to back, and we've got, this challenges maybe with some unit or department or area dynamics with staffing or with equipment challenges. There's lots of other things that I know that we deal with on a day-to-day basis, and having an additional, challenge and responsibility with balancing all of that through the orientation process of somebody new can be really difficult. So, lots of barriers, I think, just in that type of situation. And maybe a better approach, you guys can kind of think through how this might have been done differently. So just looking back at the scenario, how can we talk about competencies in a way that really provides meaning and value to the fact that we have them, and then how we accomplish them? And a suggestion to you, and you probably are already doing this, which I think is great, that if you're able to work on competencies each time rather than waiting for those competencies at the, and signing off everything at the end of the orientation, you'll do yourself a favor, and it's good for kind of time management and organization to really sign off on those competencies as you guys go. That way we can keep track of accomplishing each of those competencies along the way, especially if there's more than one preceptor that's orienting this individual. That can really help keep people on track as well. Okay, so we have this scenario. It's during shift report, third week in, and you as the preceptor are having that hard conversation with the orientee about a task or a skill that they're just having some challenges with. We're not able to sign you off on your competency. We've gone through this several times. I'm concerned. This is a really good opportunity to use that cuss strategy. I'm jumping ahead. So that would be a better approach. So thinking about our concerns, honestly, with this interaction, this orientee is upset. That might be a concern. And I would also kind of think about, are we doing this in a private area where this might be rather upsetting and where they might feel ashamed about this interaction, this feedback? And there are many steps, right? There's lots of steps to lots of procedures and skills that we have in place to do, and how can we help them through that? So barriers, meaning that could be very much 100% true. We've gone through it several times. They're still not grasping it. We could talk through, maybe it has something to do with memory retention. Maybe it has something to do with the type of skill. Maybe it has to deal with maybe strategies for their learning and our teaching methods. So I think those are several different types of barriers that we could think about that might be interfering with that. And it could also be, I guess I can add this one too, it could also be challenges with the actual dynamics between the two individuals. So depending on, our approach as the preceptor, is this orientee really understanding because maybe we have other dynamics that might be interfering with that. So, would this be an opportunity then, kind of thinking forward, a better approach, making sure that it, of course, is private, we're supportive, we're validating, but we're also acknowledging, hey, this is an expectation, and how can we get you to that point? What does that look like? So as a better approach, also thinking to maybe this is an opportunity to really utilize and benefit from other team members in our area or in our unit, that they might be better off trying to accomplish this task with another team member, because maybe somebody else's approach and style and strategies, it just might click with them. Okay, and so you've tried all these different approaches and you've had this difficult conversation. You also know that this might be a time to really bring this concern either to your educator, to another preceptor, to the charge nurse, or to the manager of your area. I think you've got lots of other personnel resources that you could rely on too. So if you find yourself in this position with an orientee, just know that as educators, we're here to help support you and here to help maybe even thinking through, trying to be creative in some of these strategies with retention and competency accomplishment. So please let us know if this is an area of concern that you are encountering, and then reaching out certainly to their manager as the ultimate individual to help with accountability and responsibility for accomplishing these competencies. And lastly, we have this situation where in this third week during shift report, it's time management. And when I think in some way or another we can all raise our hand where we may have encountered situations to where time management was difficult for the orientee and even for ourselves. When I was learning, putting myself in their position, when I'm learning things for the first time, it takes me a bit, for me to really jump on and feel like I'm organized and what that looks like for me and how I can plan my day. And so, based on this orientee's response, well, it's not my fault. You didn't tell me that. And who has heard that? Okay, so concerns meaning maybe, and the pickiness, right? Is that true or is that not true? Okay, did I say that? Was this a conversation that we have had? So that might be a point of clarification, and how that's coming across. Again, this is a difficult conversation. I feel like the preceptor started off really well. I'm concerned, right? This is a way that we can approach a conversation that has to be very difficult. So might some barriers be where an individual, this orientee, is having a hard time owning up to the fact that they have an area of improvement that's needed. So I have my own process. You're just being picky. Do we have something that we can utilize to help demonstrate or show that, yes, actually, these are the expectations, and here's where it says that. Here's the policy. Here's the procedure. And I think that could help give the support that you might need to really say that this is the expectation and this is why you can count on that being a specific way that we have to do that. So some barriers there, and it kind of mentioned a little bit about a better approach. And I think that, not to say that this conversation should not happen, it absolutely should. And again, if you're finding that you're reaching some roadblocks in the strategies that you've tried to overcome this particular type of challenge, and these are some of those skills that are really difficult to kind of, they don't really have a checklist as so much as a competency of time management. Well, we wish. So that might be a really difficult one to pinpoint. But if they're struggling with not being able to accomplish things in a timely manner, I mean, there's timed things throughout our day that really need to be accomplished. And those are some of the things that we can provide as evidence to say that this is why I see that. This is where I'm seeing that. And we can try different things to help problem solve together. I want to help you with this together, right? I want this to be something that we are going to be able to work on together. And here are some ideas. We can try this. Does this feel like it might be helpful to you? So I think that there are some things that, time sensitive, not completed on time. There you go. So having that difficult conversation and giving them some other ideas, and that pretty specific examples, like we may have been able to bring forward some certain things that weren't accomplished in that time frame, and helping the individual see, and it's really going to be the delivery, you guys, right? With that type of constructive feedback, using assertive communication, I statements, this is what I noticed, help me to be able to, find a way that we can get this accomplished for you. I want you to be able to feel confident in this and to be at your best. I want you to feel that you are supported. What does that look like? So really having that collaborative type of conversation can help when we're challenged with individuals that may not have the same insight that we're seeing on our end. Thank you, guys. I hope this was helpful and give you some ideas on how to interact in challenging situations.